Now, it's important why we even care about polls. Like, why do I even want to do polls? I don't even like polls. You might be thinking, um, why is the post even important? I just like to ask questions, right? I mean, it's fine, but if you have that thought, now it's important. It's important to see that Maijing almost exclusively, right, uses the Chunko pulse diagnosis. So as a method of determining life and death, right? So we're able to diagnose is the method of able to predict the prediction of the life and death of the five Zhang and six Fu, right? And what I mean by Chunko is basically the radial artery, right? Because we have to understand that first of all, you have to see that the pulse is seen as the method of predicting life and death, right? Because you have to remember that the pulse is an expression of the Shen, the heart governs the vessels. And if you understand that conception, then you understand that taking uh, and reading that artery at the Chun, at the Sunko, right? We are basically accessing the life and and predict and potential death of the heart itself, right? Um, and so that's the basis. Now, why I say that Maijing almost exclusively uses Shunko post diagnosis, by what I mean is I'm differentiated between, for example, in the Neijing, you have different post methods. You have this thing called Sambu Joho or Renyin Sunko. Renyin Sunko is when you take the pulse in the radial artery and compare it to the radial artery. Renyin, Yang, Sunko, uh, the radial artery, yin, right? And then there's sambujoho, where you take pulses in different aspects, the face, the wrist, right? Lung 9, heart 7, um, and of course, PC7, right? I think even the renowned Jimmy Chang uses now the pulse at heart 7 to predict like hormonal uh, dictations in a woman, right? Hormonal permutations in a person, right? Because Xiao Yin so has to do with kind of Jing, right? But in the old days, you were able to diagnose through different places, right? Different pulsations. For example, if you want to predict if somebody is going to have a heart attack, or you might want to do a pulse at heart 7. If you want to predict how a person Jing is, you might want to do the pulse at Taishi, kidney 3, right? Uh, that's the source point of the kidney, right? Each of them are kind of a different source points. You notice that? But the Maijing exclusively uses the chunko, that radial artery that we learn by the lung channel. Now, why did they even choose the chunko? Well, because first of all, even though we're predicting the heart, right, the heart's breath through yin and yang when the pulse expands, right, diastolic and systolic when it contracts, we are doing it through metal because there's the idea that the heart cannot be accessed directly, right? The heart cannot be accessed directly. So one way that we access the heart, it's through what it governs, right? And that's the lung. Remember, fire controls metal. Fire sends its mandate through metal, right? The heart through lung connection. So it's kind of the lung is the minister, right? So the lung is the person that delivers the message throughout the entire kingdom, right? That's what we say the heart governs yang kind of thing, right? Xiao Yin, fire, face. And then we say the lung governs qi. You see, the qi is kind of like the child of the yang, right? So we are assessing the child of the heart. Essentially, we are predicting what the heart is, the message the heart is relaying by understanding by talking to the messenger of the heart, because the heart doesn't want to be talked to necessarily directly. We are already talking to the heart directly by touching that vessel, right? Liujing Pulse diagnosis. Liujing Pulse diagnosis is mentioned. So this is the pulse method I want to showcase to you. The 6-channel pulse diagnosis. The Liujing Pulse diagnosis is mentioned in the last volume of the Maijing, right? So volume 10. In the old days, these were seen as scrolls, right? The scrolls. And in that volume, there are basically 4 chapters, right? There are 4 chapters. And these 4 chapters contain the Liujing Pulse diagnosis that will be presented today. It's important to mention this type of pulse diagnosis is a 3-region pulse method, as we are dividing the pulse into Chung, Guan, and Chi, right? Because some pulse methods don't divide the pulse into Chung, Guan, and Chi, right? But this is a 3-region pulse method, right? Chung, Guan, and Chi. And that is actually part of the Sambu Joho segmentalization. Remember, Sambu Joho means Sambu 3 regions and 9 indications. I think that's how they often translate that. So there'll be 3 regions. So your head, pulses in your head, there'll be 1, in your wrist, and in your feet. That's 3. Heaven, humanity, and earth, right? Heaven is head. Humanity is the pulse at the wrist, and then the pulse will be the earth pulse will be in the feet, right? Kidney 3, lung 3, kidney 3, liver 3, and I think they use often Chongyang, stomach 42, right? And then there's 3 pulses that we take in each site. But when we take the pulse in one place, we are actually going to use the model. But now we are basically just using heaven is the Chun, right? Guan is humanity, and Chi is earth, right? So we are still using the method, and we are going to divide the pulse into 3 depths. That's the 9, right? That's the 9. Because each position has 3 inside it, right? Superficial, middle, deep. And so what these authors did is, well, you don't have to take pulses all over the body. That's so annoying, right? You could just do that method, that concept inside this artery, right? And already we are choosing the lung channel because, remember, we're saying heaven, humanity, earth. Humanity is the meeting place, the yin-yang between heaven and earth. So the wrist has to be the place we could take the pulse everywhere, because it is the connection between heaven and earth, right? And lung governs the chi, so it is the perfect channel to diagnose this heavenly and earth connections and this tiandiren, this heaven, earth, humanity, pathological distortions. Now, before we go into the specifics of pulse method, it must be noted that there's a connection between different pulse image and a correlation to a specific Liujing, right? This is based on this text, the Huangdi Ba Shi Yi Nanjing Suan Tu Zhu Jie. They say floating is yang, right? And they say floating is a Xiaoyang pulse. They say slippery is yang. Slippery is a Yangming pulse. Long is yang. Long is a Taiyang pulse. Deep is yin. Deep is a Shaoyin pulse. Short is yin. Short is a Jueyin pulse. Choppy is yin. Choppy is a Taiyin pulse. So when they say floating is yang, they mean that has to do something with wind, right? With wind. Shaoyang has to do with wind. So that's why it manifests as floating. So floating is not always Taiyang. It could be that there's some type of surging wind, right? And that's the Shaoyang aspect. Slippery is yang because it's slippery often is taught about a phlegm, but that's not always correct. Slippery just means there's an exuberant of qi and blood. That's why we see it as a pregnancy pulse, right? Slippery can be Yangming, right? Pregnancy is basically Yangming taking place. That's why women get nauseous, gets vexation, right? Vomits during the first trimester. That is Yangming because there has to be Yangming closure. Yangming has to gather. You have to nourish the fetus, the tai, right? Yangming has to close, right? It's typical for women to also get constipation, for example. So that's an aspect of why slippery is Yangming. Long is yang, is taiyang, because taiyang is all about the highest yang, right? So there is so much yang, the greater yang, that the pose becomes long. It exceeds the chun or even the chi, right? Or even the chi. Some people say, well, you have a pose of the chi that extends past it, and they say that's a taiyang pose. So you have pain in your back, right? Pain in your neck. But the long pose of taiyang can also pass the chun, right? It could pass the chun. And that means there is basically head symptomatology. There could be a brain tumor. There could be brain bleeding. So if you see a chun pose that is passing past the chun, that means there might be head symptomatology, right? There's head symptomatology. That may be a taiyang pose. There might be stagnation of fluids in your brain. It's not as, when we say taiyang, we're not necessarily just saying taiyang disease, you have just a wind cold. I'm meaning you have disease in taiyang representing your head, for example, representing your brain, for example, representing, you might have meningitis, right? Just that head region is taiyang, right? So there's exuberant yang in the taiyang region. For example, in Dong acupuncture, we use the point zhengjin, right, at the Achilles tendon, right, by taiyang to treat brain tumors. So taiyang has this relationship to aspects in your brain, for example. So don't take taiyang as just a common cold. That would be incorrect. Deep is yin, deep is shaoyin, because shaoyin is about yang internalization, it's about winter. Short is yin, short is dragon pose, because short means there's it's opposite of taiyang. There's little blood, right? Little blood. There is little yin qi, right? There is, you've lost the ability to consolidate, right? That's about dragon. You've lost the ability to have resources. And choppy is taiying, because choppy has to do not just with blood stasis, although it can mean blood stasis. It's also a type of blood deficiency, of a nutritive weakness, right? And taiying is responsible for producing qi and blood, right? And if you don't have qi and blood, then you might have qi and blood stagnation. You might have blood stagnation, because if you don't produce enough blood, then your blood becomes static, right? So it's often a pose of taiying is not producing enough qi and blood. So don't often think chopping blood stasis. In fact, blood stasis is often secondary to the blood deficiency when we think of choppy pose.